California.
I want to thank the senator from New York for putting this into context for America. What has happened here this morning is, instead of celebrating with us, because tomorrow, August 1st, an entire list of preventive services for women go into effect because of Obamacare, yes, our health care law. The Republican leader says he wants to repeal all those benefits. Mr. President, not only does the Republican leader, in behalf of the Republican minority, want to repeal the benefits that go into effect tomorrow for women, he wants to repeal the entire health care bill. He wants to have an amendment to the cybersecurity bill, which is so critical to our national security. He wants to put an amendment on there to repeal a law that the United States Supreme Court found was constitutional and whose benefits are beginning to take hold in this country. Benefits that mean that right now people are receiving refund checks in the mail because their insurance company overcharged them, and under Obamacare, you can't do that. And hundreds of millions of dollars are going out to our people. The Republicans want to, I assume, force those people to send back their refunds because they want to repeal Obamacare. Look at the list of preventive health benefits that are already in effect because of the legislation. Let's lower this. Already, because of health reform, and I see Senator Harkin here, who shepherded this through as our dear friend Ted Kennedy became sicker and sicker with brain cancer. And I'll never forget how Senator Harkin stepped up to the plate, Senator Dodd stepped up to the plate, Senator Mikulski stepped up to the plate, and they were the lieutenants who got it done. And the Republicans want to take it away. I can only imagine how Senator Harkin feels, having been in that fight. But I'm here to say I'm your supporter. I know what you did. And I know that my people in California, the largest state in the union, are getting breast cancer screenings now with no co-pays. They're getting cervical cancer screening, hepatitis A and B vaccines, measles and mumps vaccine, colorectal cancer screening, diabetes screening, cholesterol screening, blood pressure screening, obesity screening, tobacco cessation, autism screening. How important is that? In my state, they say there's an epidemic of autism. Hearing screening for newborns, sickle cell screening for newborns, fluoride supplements, tuberculosis testing for children, depression screening. How important is that? Osteoporosis screening. I watched as my mother just was in agony from osteoporosis. And there are things you can do now to avoid it, but you need the screening. You need to know whether those bones are losing that density. Flu vaccines for children and the elderly. And this list goes into effect tomorrow. So let's take a look at the list that goes into effect tomorrow that my Republican friends want to repeal today. Tomorrow, women will get access to all of these things without co-pays or co-insurance. Contraception, well woman visits, STD screening and counseling, breastfeeding support and supplies, domestic violence screening, gestational diabetes screening, HIV screening, and HPV testing. I am stunned that on the eve of the broadest increase in benefits in my lifetime, the Republicans want to repeal these benefits from women. This is a continuation on their part of the war on women. And they can get up and stand on their head and deny it and everything else. How else can you explain why on the eve of the day that the women are going to get all these benefits, they want to now cancel Obamacare? and stop all this from happening. And if you think it doesn't matter, let me say to you, Mr. President, I know you know it matters whether women get free contraception, to cut back on unintended pregnancies and abortion, and well woman visits, and breastfeeding support, and how about domestic violence screening? So critical. Some women are in these terrible relationships and they go to the doctor and they say, well, I don't want to talk about it. Doctors will be taught how to spot domestic violence, and there can be an intervention that will save lives. So here we stand. We have this list of benefits, women's preventive health benefits, going to go into effect tomorrow. We are here to celebrate that. And instead of our Republican colleagues coming on the floor and joining us and saying how wonderful this is, and by the way, at the end of the day, this saves money. We all know that. We all know it saves money when you have screening and counseling for STDs and you head off an illness. We all know it saves money. And the health care bill saves money. And it reduces the deficit because of this investment in prevention. So I can't think of a more ridiculous situation than after a bill has become law for how many years now, Senator Harkin? Is it a couple of years that we passed it? 2 years? It went to the Supreme Court. It's upheld. And now, just as we're about to see these great benefits for women go into place, the Republican leader says, let's repeal Obamacare today. Let's have an amendment on the cybersecurity bill, he said, to repeal the entire health care law. Now, the House voted 33 times at least to repeal it. So I'm wondering, what is with this idea of repeal? Do you really want to take away these benefits from women, from children, from men, from families? Yeah, I guess you do. I guess you stand for going back to the old days when people could hear from their insurance company that they were cut off. When insurance companies could spend 70% on themselves and their own perks, and CEOs getting, hundreds of millions of dollars, and you, the patient, getting hardly anything. They want to go back. They want to take away the refunds. They want to take away the funding that our seniors are getting as they deal with the high cost of prescription drugs. And we fixed that in this bill. So I have to say, we make an investment in prevention, in keeping people healthy. We make sure being a woman isn't a pre-existing condition. And the Republicans today have relaunched their war against women. They're holding up the Violence Against Women Act that we passed over here in a bipartisan way. They won't take up the Senate bill and pass it. Why? They want to take away coverage of that bill from 30 million Americans. They don't care about the immigrant population, obviously, the most vulnerable women there. They don't care about the college students, apparently, because we get extra protections for them on college campuses. We protect the LGBT community. Clearly, they're not interested in that. And they're not interested in protecting the Native American women. So while the Speaker says, oh, I will send conferees to a non-existent conference on a Violence Against Women Act, he could simply pass the bill and make sure that everyone is protected. And instead of celebrating today, because women are getting all these wonderful benefits without a copay, they want to repeal all these benefits. They want to repeal this law. And I could just say, truly, I don't know what motivates them. I do not speak for them. But if they say it's to save money, that's simply not true, because this bill saves money. This law saves money because we're investing in prevention. So the only thing that I can think of is they want to hurt this president. The Republican leader said his highest priority was making sure that President Obama is a one-term president. So I guess if it means attacking the health care law to hurt this president, he's willing to do it and hurt all my constituents who are getting these benefits and all of our constituents who are getting this benefit, hurting the American people. Well, I say put politics aside. Let's see the Republicans come down here and celebrate the fact that finally our people are getting the health care they deserve and that they pay for. Thank you very much, and I yield the floor.
President.